Roots of the Science podcast with your girl, Anne with an E.
Hi everyone, and welcome to another episode of the Roots of the Science podcast with your girl, Anne with an E. Today my guest is Dr. Admore Jokwiro. He is a medical doctor from Zimbabwe and has nearly 10 years experience working in the public health sector. Currently, he is a district medical officer for Nyanga in Manicaland Province, Zimbabwe, a position in which he administers health services, preventative and curative for the district. Recently, he completed a master's in eHealth management with the Rome Business School. With that, he formed the Zimbabwe Telemedicine Network, an organization which is actively pursuing the development of eHealth solutions to solve challenges within the health sector in Zimbabwe. In this episode, we learn how his early influences into medicine led to his career into medicine and why he believes eHealth can be used to improve access to healthcare and the importance of public health informatics in decision-making to improve population health, especially during this period of corona. Do stay tuned. Hi, Dr. Jokwiro. Thank you for coming on the show.
Hello, Anne. How are you today?
I'm good. I'm excited. How are you?
Fine. I'm also doing very well.
Oh, okay. So thank you again for taking the time to chat with me. I'm very excited to hear about you and everything that you're doing.
Thank you for the opportunity, Anne.
Okay, so just to get straight into it, can you please just tell me about yourself? So where you're from, where you're currently based, and because this is the root of the science, but just to get away from the science stuff, I want to know, are you a soccer fan? And if so, what's your favorite team?
Well, so thank you so much again for the opportunity to be speaking to you today. I'm Admore Jokwiro, if you have said, and I hail from Zimbabwe. I was born in a province called Manicaland East, which from a rural town called Murewa, which is about 100 kilometers from the capital city, Harare. And that's where I spent the first part of my life. Primary school, half of my primary school was in that Murewa community, and then we relocated to Mutare when my dad was transferred to start working in Mutare, and that's where I completed the rest of my primary and high school education in Mutare. I learned in Murewa. I was at a school called Kambarami Primary School, and then when I relocated to Mutare, I did learn at Rujeko Primary, Chikanga 2 Primary, and then later I did my high school at Mutare Boys High School. From Mutare Boys High School, I again went back to Harare to start medical school at the University of Zimbabwe. So growing up, it was one of those dreams that I had, that I wanted to be either a pilot or a medical doctor. And eventually I sometimes actually fail to remember how I then settled for a medical practice. To be a medical doctor. But at some point in time, I stopped wanting to become a pilot, and I still have to actually probably do some research on myself how that came about. But I remember that when I was in primary school, I used to alternate between pilot and a medical doctor. You know how it is that
Yes,
every other school term, the teachers would be asking you, what do you want to be when you grow up? And they would write it in some other register somewhere. I don't really know, what used to happen then, but I remember that I would alternate every other term. But anyway, so by the time I finished high school, I had made up my mind that I wanted to be a medical doctor, and it was a question of fulfilling the requirements. And I thank God that I was blessed, and I managed to pass my high school, and I was able to enroll as a medical practitioner in training at the University of Zimbabwe. And that took us about 5.5 years to complete because of challenges we experienced during the training, the economy in Zimbabwe and everything else. But eventually we managed to complete, and I did my internship at Parenyatwa training hospital, which is one of the major referral hospitals in Zimbabwe, and I took 2 years to complete my internship. And after completing my internship, I straight went into practice, and I went back to Manicaland. This time around, I went to Nyanga district, which is about 100 kilometers away from Mutare. And that's where I started working as a government medical officer. And for the last 10 years, I have been at Nyanga District Hospital. And now I'm the district officer for Nyanga. But last year, I had an opportunity to further my education in electronic health, and I think this is something that we'll also spend some time to discuss. And then I had to briefly shelve my work so that I could go back to school. So I'm currently enrolled at Emory University Rollins School of Public Health, where I'm completing the Hubert Humphrey Fellowship, and I'm taking courses in public health informatics. As I mean, away from science, away from medical practice, I'm a soccer fan, yes, and I'm in Zimbabwe. I support Caps United, and like one of my international teams is Manchester United, and but I'm more of a cricket fan as opposed to soccer. So I love cricket, and I follow the South African T20 League, Mzansi 20, Mzansi T20, the Indian Premier League. I'm a crazy cricket fan, so
So
I
you must
prefer
be
cricket to
suffering
soccer.
because of the break that's going on in sports then, hey?
Obviously, there's been a death of sport, totally on virtually all platforms. I have, I mean, an app on my phone for me to watch cricket matches, and
Oh, wow.
so it's been crazy. But I've had to accept that this is what's happening. I mean, around us. COVID is very much around, and we have to stay safe.
Mm, mm, definitely. No, thank you so much for that very thorough background check on you. And like you mentioned that you've had 10 years experience as a medical doctor. However, you then went on to take on this fellowship and do electronic health. Can you just explain how that happened and how you got the opportunity to study at Emory University?
So I think having joined Nyanga District, I started working in 2012 at Nyanga District Hospital, and when I got exposed to the public health system, there are a lot of experiences that I had that have shaped the destiny, I mean, my destiny in terms of as a medical practitioner and
Okay.
where I am at the moment. Why I say this is that some of the challenges that I came across when I started working at the district hospital were things to do with access to healthcare. So I had always assumed that every other person who wants to visit a health institution can always be able to do that. But then now working at Nyanga District Hospital, I discovered that this was not always so. There are people who stay very far away from health institutions,
In remote
um,
areas.
very remote areas. Nyanga is such a mountainous, I mean, region where people have challenges in terms of getting to their nearest clinics. There are people who survive on less than $1 per day, who don't even have transport money to be able to get on public transport and come to hospitals.
Yeah.
So this transformed and modeled and inspired me to start thinking about how we could ensure that those people who stay in such communities can be able to access healthcare. And this is where I started venturing into telemedicine. And in 2015, with the help of our House of Assembly member, like the Member of Parliament for Nyanga South, Honorable Superman Duanzira, we were able to set up the first telemedicine, synchronous telemedicine facility where we installed internet connectivity at a rural clinic using satellite technology, and also installed internet connectivity at the district hospital where I was based. And we started using Skype video conferencing. So just like we are
Oh.
talking on Skype today, of course we don't have the video on, but in this particular case, we were using Skype along with the video module. So the idea was that the nurse at the remote clinic would come in on the Skype call with a patient, a patient who originally they would have transferred to come to the district hospital for management, say, of hypertension or diabetes mellitus. I would then see the patient physically, though virtually, and talk with the nurse and the patient, and help the nurse to manage this patient, like adjusting their medications,
Oh.
just answering to the complaints that the patient would be bringing about, which the nurse cannot be able to manage. Because the thing is, in our clinics, we have what we call primary care nurses. So these are the people who are responsible for managing the patient at the clinic level. So sometimes if they don't have the adequate expertise or knowledge, they then refer these patients to come to the district hospital. But remember, some of these patients are quite old, maybe older than 65 years. So for them to travel on their own, it's difficult. They need people to accompany them, and that also means some more expenses. So we started piloting this telemedicine initiative, and we got support from the government. And 3 years later, we were able to roll out this system in 5 more clinics in the district, again
Wow.
with government support. So this is how I started studying telemedicine, electronic health, mHealth. I started venturing into mobile applications for health, and sometime I think about 1.5 years ago, there was this advert that I got on Twitter about the U.S. State Department in Zimbabwe offering these scholarships where someone can be able to go and learn more about a field of their interest. So I jumped in on it and applied, and I thank God I got the scholarship, and it has been rewarding. I mean, I've been exposed to the science behind electronic health, and that has, I mean, really helped me. And I know when I go back to Zimbabwe, I'm not going back the same. I now have a richer understanding of electronic health, what it can do. And I think the COVID-19 pandemic, of course, it's not a blessing. I mean, we don't want people to be dying and everything else, but it's beginning to transform our people, our leaders, to appreciate the importance of electronic health. That,
Definitely.
yeah, so I think we will be able to, along with other Zimbabwean medical professionals, to be able to ensure that we can improve access to healthcare by utilizing such technologies.
No, definitely. And I just want to commend you on the work, and just take it back to what you said that there's a lot of communities, like you said, in these remote areas who I'm sure are benefiting significantly with that telemedicine initiative that you've rolled out into into these areas. And in terms of now that you said that you took the opportunity, thank God for Twitter, that you saw that advert, that you took that initiative and you've learned what you've learned. So I just want to know, you said that when you go back home to Zimbabwe, you won't go back the same. So in terms of what you know now, how will you use what you have learned so far back into the communities, for example, at Nyanga district clinic, you know, in terms of everything that you've learned so far?
Well, thank you for that question. So before I answer it, I want to reinforce that indeed, yes, I saw the advert on Twitter. I mean, it's funny how I tell many people that this is what happened, because sometimes people think, I mean, I did something extraordinary to be able to get such an opportunity, or I mean, I saw it somewhere. But honestly, I saw the advert on Twitter, and I responded to it. And I think what I'm just trying to highlight here is the importance of platforms like this platform that you are hosting, that they can contribute to social development. Because if I hadn't registered on Twitter,
Yes.
there's no way I would have been here and actually doing this fellowship. So it's important. I mean, communication is very important.
Yeah.
So in terms of what I have learned and what how it is going to impact what I'm going to be doing. So one of the things that I have learned around public health informatics, for example, which I can cite, is evaluation of health information systems.
Okay.
That
What
is a
does that
skill.
mean in
It's
simple?
okay.
Break it down for me in a
Yes.
very
So
basic form.
that's what I just intend to do that.
Oh,
Sometimes you can set up the telemedicine platform that we did set up in Nyanga. But you want to be able to evaluate or understand how it is improving healthcare, say access, how it is improving, suppose health outcomes, like the patients that you are seeing on the platforms after 6 months, after a year, how are they doing? So
yeah.
that could be some form of evaluation. So I mean, without that knowledge of how you can do that, you may not be able to improve the quality of the service. You may not be able to expand the range of services. So evaluation or assessing the value of what you are doing is an important aspect of any system. And
Yeah.
this is one of the skills that I've acquired in terms of this fellowship. Another thing is understanding the importance of health information exchange, making health information available, utilizing it, and data science, like analyzing the data that you get. So suppose you have devices that you have deployed, and they can be able to gather or collect health information, processing that health information to come up with stories which explain the burden of the disease, the trend, as in, are you having a rising trend in terms of malaria cases? Are they falling? Are you having a challenge in terms of malaria outcomes like deaths? Are you having more deaths? And where are these deaths happening? Are they in a certain village in your community? Are they in a certain location, or they are scattered all over? This can help medical practitioners to be able to come up with interventions which can tackle those conditions like malaria. Because if you don't know, if you don't have a situational awareness, or if you don't know what's happening around you, you cannot be able to respond. So, like if we take the COVID-19 example,
Yes.
and the lockdowns, there is science behind these decisions. When the cases were rising fast, before hospitals were ready to be able to tackle these conditions or cases coming in, the decision to have lockdowns and keep people at home is to cut transmission, because people are no longer walking around in the public malls, in restaurants, and everything else. People are not interacting, so you cut down the transmission. But once you have an understanding of what's going on, once people have been taught how to use masks in public places, now testing is available and everything else. When you begin to evaluate those interventions, you can say we can now ease the restrictions, because we are now in a position where we can be able to respond to the pandemic. So
Yes.
this has been possible because of understanding the medical information around you, that the cases have now gone down. So we have contained the condition, so we can now be able to move in this direction. So that is also the importance of data science. And digital health is rich in terms of such aspects of data science, where you can be able to do analytics on your data, come up with stories and tell those stories, and those stories are able to inform public health physicians to make better decisions. Another thing is clinical decision support systems, where you set up tools that can enable healthcare workers to be able to make better decisions. So suppose I'm consulting a patient, and I get to the stage that I'm now prescribing a certain medication. I may want to know if that medication has side effects. I may want to know if that medication can interact with other medications and affect the other medications. That will help me in making a decision of giving you the best drug. And we call those digital platforms clinical decision support tools. So we now have automated mobile applications, which I can easily be able to punch in the name of a drug, and I can get those ideas to say it has these side effects, or it can interact with this sort of medication, so I should try this other drug. So these are tools that we are going to to deploy back home, supporting the Ministry of Health to be able to have such technology within its facilities so that we can improve clinical outcomes.
Wow, that's fantastic. That's very fantastic because, like you mentioned, especially post coronavirus, using data science and all of this data information is going to be beneficial not only in communities in Zimbabwe, but I think all over Africa as a whole. This is something that can be rolled out, and it's very interesting how people like yourself who are able to assist government currently in this COVID-19, who tell them, like you said, that there is a science behind all the decisions that are being made based on the COVID-19 and all of this to minimize the transmission. So your work is very, very important. And you said earlier in your introduction that in 2015 you piloted the first telemedicine consultation service in Zimbabwe at Nyanga Clinic. Apologies. So can you please just further explain what your consultancy does?
Okay, so this telemedicine platform that we have established in Zimbabwe, and now we are running a national pilot, which is probably going to be evaluated at some point in time this year. I think the COVID-19 pandemic has affected that plan, which was there to finally commission the system, because it has been running for 1.5 years, and it's now due for its commissioning, which will probably allow other places and other districts to be able to actually borrow and replicate the concept. But what we have been doing is that we provide what we call clinical decision support or second opinion for the clinics that we are connected to. So there's a total of 6 clinics in Nyanga district which are connected on this platform. What they do is that they see patients, and if they have patients that they feel a doctor must come in and support them, they then book these patients, and on certain established times, our doctors then get on to this platform and interact with these nurses and patients live. So we see virtually any condition, from chronic illnesses to acute illnesses, but within the scope of what is possible, we then advise these nurses and the patients on the next steps. So there are certain patients that can come onto the platform, and if we feel this patient needs further management, we will advise this patient and the nurse to make a transfer immediately, if possible, and the patient comes over at the district hospital, say for further tests or for further management. But if it's a patient who is wanting medical advice, to answer a question or to adjust medications, or general advice under routine care, we just manage this patient at that end, advise the patient, and sometimes we do electronic prescriptions for their refills. So the platform allows us to see any patient because we are backed by the fact that we are working within a clinic setting. We are offering clinical decision support to a nurse who is already consulting a patient. So that allows us to be able to support them on anything that they are doing, which is medical. And we even use the platform for medical education as well. So sometimes we conduct tutorials and webinars with the nurses so that they can be able to understand some conditions better. And tomorrow we'll be conducting a COVID-19 awareness with 3 of our clinics which are connected on the platform. And we have found this to be very useful because there has been a training gap, a knowledge gap in terms of nurses in remote communities understanding what COVID-19 is about and what they should do, how to test it and everything else. So we are utilizing this platform to be able to deliver medical education as well.
Fantastic. Yes, I saw on your site that you do offer courses and webinars, which is very, very important, especially now to kind of discourage the misinformation that's going around with the coronavirus pandemic. So in terms of these courses at the webinar tomorrow, how do people participate? It's only for your nurses, like you said, hey?
Okay, so we have a site which the website you are referring to,
Yes.
again, which we have launched specifically to provide what we call continuing medical education or continuing professional development. So for that facility, on that site, what we are doing is we are providing what we call accredited courses, where someone gets a credit after completing a course, and
Okay.
this enables them to be able to um, continue learning, because this is a requirement in terms of when you are practicing. So anyone who wishes to acquire that credit, they register on the site, and once they are registered, they will have access to the courses that we provide. But in Zimbabwe, it is important to know that we are working with the Nurses Council of Zimbabwe,
Okay.
and they've endorsed the platform. So nurses in Zimbabwe can be able to register on the platform and get credit, because the Nurses Council of Zimbabwe is like what we call a CME provider. So they are utilizing our platform to be able to provide continuing medical education for nurses. So one thing you may also want to know is that it is a requirement for medical practitioners, nurses, and other allied practitioners to have what they call practicing licenses.
All right.
So for you to be able to have a valid practicing license, you have to demonstrate that you are undertaking continuing medical education. So
Oh,
yes, so our platform again was inspired by that lack of access for the continuing medical education, especially for remote-based nurses. They would struggle to have to travel to go to the metropolitan cities where
yes.
they, for them to attend conferences, for them to attend workshops. So we then developed a mobile application which is linked to that website which you visited, and from the mobile application they can simply download from Play Store or App Store, and they have access to these courses. They also have access to clinical tools like the reference clinical guidelines, medical and therapeutic guidelines for doses, medications, and everything else through the same mobile application. And it works in offline mode as well. So we simply designed it to be able to support especially remote-based nurses.
Fantastic. So you're taking medicine from your hardcover books and you're taking it online, you know.
Exactly. I don't
It's
think that I would have explained it any better, but that's exactly what has happened. So if you are to walk into any office, maybe for a
yeah,
doctor or a nurse, you are going to see a heap of books.
yeah,
There are guidelines for managing, say, diarrhea, guidelines for managing pneumonia, guidelines for managing malaria. So what we have simply done is to, because those books, it's not easy to distribute them to everyone.
yeah.
And again, sometimes there are changes which happen every other week or every other month in terms of management. So it means people have to go back to those books, edit one page, print another whole set of books, and distribute it again. So we have simply
Expensive.
now, it's expensive and tedious. So what we have now done is we have digitalized those books and taken them onto the mobile phone.
Fantastic. And you can literally do it from your own home, which is
Yes.
ah, that is brilliant. Great work, great work. And like you said, I think now with bringing it back to COVID, I mean, we can't run away from COVID. Information, we're getting so much information. Information is changing, and this is a new virus that not a lot of people know about. So I think having that digital access to that information, to that medical information, is even more important, don't you think?
Very true. And we quickly uploaded the Ministry of Health in Zimbabwe COVID-19 guideline on the platform, so that we could we could enable nurses to be actually have access to this information. And like you're saying, there's new information which keeps coming every other day. So we do have the ability to go on and add onto that resource, and keep the nurses updated, keep the health workers updated. So this becomes a very important tool in a time like this. I agree
Yeah.
with you entirely.
Fantastic. Dr. Jokwiro, it's been great chatting with you. But before we even close this, I just want to ask you, when somebody is listening to what you're doing, you went from the typical route of being a medical doctor, and you went on, because medicine is no child's play. Like you said, it's 5.5 years. You went on after that, you decided to go and continue to further pursue your studies as you are now in at Emory University. What advice would you give to an aspiring African in STEM as a whole, but specifically in your career of choice, about getting into it? Because it's not so well known, but it's actually very important. And like we mentioned earlier, we're moving into the fourth industrial revolution and post coronavirus. Careers and fields like that are going to be more and more important. So, what advice would you give somebody about getting into that field?
Well, I may actually disappoint you in and tell you that maybe I was running away from the difficult things and was looking for a softer spot, so I landed on eHealth. But I'm joking. Like how I got to where I am at the moment, I think I may not be able to explain it scientifically, but one thing that inspires me is purpose. So at times you can be able to understand what you do, you can be able to understand how you do it, but I think to me it's more important to understand why you do what you do, why you do whatever you do what you do. So I would want to reflect this back on you and say, like the root of science, this is something that you yourself as the founder would be passionate about, and you have a goal, I mean, of something that you are trying to achieve by using such a platform, and this is what keeps you going. Every day you wake up, you are thinking, how can I improve it, how can I do it better, and everything else. So this has been my story as well. I have always said, yes, I'm a medical doctor, but I want to make my world a better place. I want to make Nyanga a better place. I want to make whatever I do to result. I mean, the result I'm looking at is improving and making it a better place than I met it. So are there challenges around me? Yes, there are many of them. And if I go out to meet those challenges and come up with solutions, to me, that's how I define success. So this is what this is what led me to eHealth when I was looking at access to healthcare. How could I improve access to healthcare? How could I make the people that I'm meeting, when they are telling me that, doc, I can't come and see you because I don't have money, I cannot be able to give them money, but I could make healthcare available to them using the internet. And how the internet has impacted in our lives, this is something that we cannot ignore. If you were to look back 10 years ago, how we used to send each other money, and now
Yeah,
how we do it using our mobile phones.
digitally.
If the internet was able to impact the financial services sector, I also thought it can be able to have the same results within the health sector. The way we apply to universities right now, you may start an application right up to the end without even sending any paper. Can
Yeah.
we do that in the healthcare system as well, to be able to consult a patient and finish a consultation without using any paper? It's very possible. The way information has become available and how we can be able to make use of that information to guide our decisions, can that also apply within the health sector? Very possible again, and that's digital health. So that's why I would encourage every other healthcare professional, whether you are in any specialized field or not, digital health really has an impact and can improve any service that any medical practitioner is providing, because the more you have information about what you are doing, the more knowledge you are going to have, and the better decisions that you are going to be able to come up with for your patients and for your communities. So as I look forward for Africa or for Zimbabwe, we need to understand transmission patterns of diseases. We need to understand like severity. We need to understand outcomes. We need to understand a lot of characteristics about the conditions that we manage. I see health information systems having such an ability to be able to guide us with that knowledge. And so it is important for us to all acknowledge that this is a field that we have to dedicate some resources to. And have more professionals coming up, forming a community which can be able to then utilize these platforms and protect our communities better. So any other medical practitioner, young practitioner out there, I really say this is something that I would wish we had many more people pursuing.
Definitely, definitely. We do need so many more people into that. And I am so excited for what you're going to do, not only for Zimbabwe, but hopefully for the rest of Africa, and even more so for the world, and all the many people that you're going to help with, bringing healthcare to these remote areas, because sometimes people in those remote areas tend to be forgotten. And it's good to know that you are thinking of these ways, and it's very admirable. So thank you for taking the time to chat with me. This was an amazing learning experience for myself as well. I learned a lot, so thank you.
Thank you, and again, thank you for the opportunity and the work that you are doing. This is also something that I really appreciate, and as a continent, I think we need such, and I look forward to learning more stories about African science from your platform.
Thank you so much. And with that being said, to everybody else who's listening, thank you so much for listening to another episode of The Root of the Science with your girl, Anne with an E. Until next time, goodbye.